part of that is being responsible for your own health. It's not up to your doctor. It's responsible to you. There's many new technologies now. I'm wearing, for example, a little wristband here that can track my steps and my sleep and how many calories I've performed. And I can use this to stay on top of my exercise and my sleep. And I can share that information with friends on a social network and challenge each other to do better. And I think we have the opportunity to use these sorts of technologies that might start for getting better exercise, but use those to get better at treating other medical problems. So for example, the world of mobile technology, the phone is really becoming a smart platform. I have a special case on my phone that can measure an EKG. So instead of having to go to the hospital or the clinic, I can record an EKG directly on my phone. And that can be sent to my doctor, to my cardiologist, and help, if I had heart disease, help me manage my heart disease. Or if I'm a nurse or a doctor, I could give this to someone having chest pain. And that's just one example of diagnostics coming together with smartphones. Many new opportunities to see in real time the effect of meditation or medication on the brain and optimize that and personalize therapy. In some cases, of course, we treat disease often when it's late, when it's already appeared. For example, Alzheimer's disease. Well, now there's a new type of MRI scan and imaging where you can see the plaques on the brain of a patient even 10 or 20 years before they develop clinical Alzheimer's disease. And maybe if we can then detect that 10 or 20 years early, we can start therapies and interventions that are much more effective than the very few tools that we have today for the big problem of Alzheimer's disease. Most of our cardiac patients get an ultrasound to look at their heart. It takes half an hour, then a cardiologist has to read it. Well, now a 5 to 10 minute MRI can take all that information, put that in the cloud, access that through your iPad or even your phone, and get all that information about your heart in one integrated file that can be explored in real time. So these things, again, may disrupt and change the world for some cardiologists and some radiologists. The problem is many of our data is still old analog, right? Maybe you still have your old tapes. The challenge is to get that into digital form. And when we can do that, we have a lot of opportunity. So in fact, even my stethoscope now is digital. It can talk to my smartphone. It can record the heart sounds. There are now apps that will analyze the heart sounds and be better than the best cardiologist in the world. So there's big opportunities now to, again, rethink how we take information and sort that. It's now because of all these technologies getting faster, smaller, cheaper, and better, that we can fit into our phone hundreds of thousands of dollars of technologies that used to be separate. And there's the opportunity now for patients to get more engaged in their healthcare, and for physicians and healthcare systems and for policy and government to use this data information to keep people healthier, to prevent disease, as opposed to spending most of our dollars when someone has the heart attack or the stroke or has had cancer.